Good afternoon, and thank you for joining us for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 108 new cases of COVID-19. This brings our statewide total to 479 Pennsylvanians who have tested positive now in 33 counties. Yesterday, we had 103 new cases, and today we have 108 new cases of COVID-19. Approximately 47 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first cases. That continues to be approximately 10%. To date, 4,964 patients have tested negative to COVID-19. I know that this is a difficult and stressful time for everyone. It's so important for everyone to follow the direction of Governor Wolf to please stay home, and for businesses to please close, and for everyone to do their part. I know that Pennsylvanians are strong and resilient, and that our community will get through this if we all work together. Now, here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water is not available. Cover any coughs or sneezes with your elbows and not with your hands. And try not to touch your face, especially after touching a surface. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your health care provider. If you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I'm pleased to answer any questions.
Thank you, Secretary. From KDKA, will we reach a time during this epidemic where we have enough tests for everyone to get tested, whether they meet the criteria or not?
So, through many different methods, we have wide-range testing now. We can do tests through the Pennsylvania Department of Health, and we are prioritizing those tests for healthcare workers, for potential clusters or outbreaks, and so we can do those tests. In addition, more and more health systems and hospitals are doing tests. And in addition, healthcare providers can order tests through LabCorp and Quest, those commercial providers. In addition, in the Southeast, there continue to be mass testing sites in Philadelphia and in Montgomery County, and those are open daily. We do not want to test individuals that have no symptoms. It's not necessary, and those tests are not clinically meaningful to us because you could get exposed the next day, or you could be in that incubation period where a test would be negative. So I don't see a time that we'll be testing asymptomatic people, certainly in the foreseeable future.
And then as a follow-up to that question, there have been moments where the local and state numbers in terms of case counts don't match. KDKA would like to know Can we continue to improve communication to make sure that we're all on the same page? Can you describe how the case count works?
Sure. So at the Pennsylvania Department of Health, the numbers that we are releasing, we are pulling together at 12 noon and then doing our daily press release. And so other county and municipal health departments might be collecting and releasing their data at a different time of day or on an ongoing basis. So there might be a discrepancy for a short period of time. We are going to continue to release our results, which we collect from throughout the state. Again, we collect results from our laboratory, hospital and health system laboratories, from LabCorp, Quest, etc., at 12 noon each day, and we will release the results at that time.
And then from WGAL, do we have information on the locations of clusters of cases within each county? And are we considering shutting down takeout and delivery options for restaurants at this time?
So there are no plans to shut down takeout and delivery. We do have to make sure that people get food. Not everyone can prepare food at their home, and so takeout and delivery can be very essential for certain people. And so that would be considered a life-sustaining business in terms of the business criteria at this time.
From the morning call, can you give an overview of the activities of Pennsylvania scientists and researchers as far as vaccine development or treatments for COVID? Are all of these activities under the umbrella of the CDC and FDA? Are we sponsoring any research? And what mechanism do we have to facilitate the sharing of information on best practices for supportive care for patients?
Mm-hmm. Well, in terms of best practices, we follow the guidelines of the CDC in terms of the care of individuals. And so any information that the CDC releases to the healthcare community, we then release through our Health Alert Network. And so we are providing that information to medical providers throughout the state. We also collaborate very closely with hospitals and health systems, with the Hospital Association, and with the Pennsylvania Medical Society. So we are not sponsoring research ourselves through the state, but those are being sponsored both for vaccines as well as for treatment protocols through the FDA, through the CDC and the NIH. We certainly support our excellent academic medical centers as well as pharmaceutical companies to participate in those trials and, that are being sponsored by the federal government.
From Spotlight PA, how is Pennsylvania ensuring that the count of people who have died from COVID is complete? Is it possible that some deaths caused by COVID have not been properly attributed to the virus?
Mm-hmm. So we're working, again, very closely with local officials in all the counties, in particular our county and municipal health departments. In other counties, of course, we're the health department with our state health centers and nurses, and our great team of epidemiologists here. There are guidelines from the CDC for coroners and for funeral directors, and we have put out and passed through those guidelines throughout the state. And there is the availability of testing deceased individuals for COVID-19 through our state laboratory. And so we'll see if any individuals that have died that were not identified at that time as having COVID-19 might have had the virus. I think that those numbers would be very low, but we'll be watching that very closely.
And as a follow-up, Spotlight would like to know if the state is collecting data from healthcare providers on people who are calling in with mild symptoms that they are attributing to COVID but do not have severe enough symptoms to warrant a test.
So we're not collecting that information, but it does bring up a good point, is that if someone has very mild symptoms, maybe a low-grade fever of 100 or 101, and they have a mild cough, and they're otherwise not feeling very ill, of course, if you have questions, contact your healthcare provider. But our recommendation is to stay home. It'll actually expose more people if you go to an emergency department or some other testing area, and we want to prevent the spread of COVID-19. Of course, if you're having an emergency, urgent symptoms, then call your healthcare provider or call 911. We want to make sure that everybody gets the health care that they need, but it's critical to limit the spread of COVID-19 at this time.
From the Patriot News, How close are we to now another ratcheting up of COVID-19 mitigation efforts, like a shelter-in-place order some other states have done? And how would that affect routines like work and grocery shopping?
Discussions are being had with the Pennsylvania Department of Health, with PEMA, with local officials, and of course with the governor's office on the possibilities of stay-at-home or shelter-in-place. So I don't have any new information at this time, except that conversations are occurring. That would not mean that people can't go to grocery stores. Of course, people need food. We would like you to not to store up for 6 months, but to have enough food for at least a week or so. So you have to keep going back every day, which would increase your exposure. So we'll be seeing in the coming days what decisions are necessary to protect the public health of Pennsylvania.
From the Bucks County Courier-Times, it appears Philadelphia has now surpassed Montgomery County as the community with the largest number of positive tests. Does this signal to the department that Montgomery County may have peaked?
No, we don't think that Montgomery County has peaked, but of course the population and the population density of Philadelphia is much greater than Montgomery County. So this is expected. We certainly expect our largest urban areas, such as Philadelphia and in Pittsburgh, to probably have the largest numbers. But there is no indication that any county has peaked in terms of new cases of COVID-19.
From WPXI-TV, we're getting a lot of people who are asking about the testing process. They're saying that that their test kits are not available in their area. We know that they're conflating information since it's labs that have the kits, but can you explain for people how the samples are taken and how the tests are done? Also, do you know if any hospitals are having problems being able to collect samples or send samples?
Well, again, samples are collected and sent to our laboratory. They're sent to LabCorp and Quest. Hospitals and health systems are doing testing, and then there's the drive-through testing in Philadelphia and in Montgomery County. The testing is a nasal pharyngeal swab, which is a swab that is placed into the nose and then to the back of the throat, and then removed and then placed in specific viral growth media, and then sent to the laboratories. Our laboratory can generate results within 24 hours. Many hospitals can generate results either same day or within 24 hospitals. I believe that LabCorp and Quest have several days before their results are available. We certainly want to make sure that testing is available to be done, and we are calling upon hospitals and health systems to set up more sites outside of their emergency department to do testing. We know that those are occurring in Philadelphia, in Pittsburgh, and in other areas. We want every physician to be, or healthcare provider to be able to order a test to patients that have symptoms and need a test to be done.
This is from the PLS Reporter. Given the quantity of waiver applications into DCED, has there been talk of further delaying, modifying, or canceling outright the governor's order closing non-essential businesses?
There is no discussion of canceling the order to close non-life-sustaining businesses. I am aware that there's a waiver process. The Department of Community and Economic Development is evaluating those waivers as we speak. I believe that the Secretary spoke earlier today about that, but there are no plans to cancel the order. This order is essential to mitigate the spread, to prevent the spread of COVID-19. We need people to practice social distancing, and please stay home.
From the Patriot News, would you like to see a ban on interstate travel now? People are saying that folks from New York are shopping in Pike County stores. There's flights coming in from Florida, from spring breakers coming into Philadelphia. Is it time for those types of restrictions at the federal level?
I'm not aware of any particular discussions to ban domestic travel at this time. Of course, the stores in Pike County, unless they're life-sustaining, should be closed, according to the governor's order. And so we really want people to practice social distancing and to stay at home as much as possible. But I'm not aware of any federal plans to discontinue interstate travel at this time.
And as a follow-up question for the Patriot News, if a shelter-in-place order comes down, how would it change what can and cannot be open? Would the list of life-sustaining businesses get more restricted?
Well, if that order comes down, then the governor's office and the senior staff and all the cabinet members would discuss what changes would be made. But really, the strong recommendation now is that if you don't need to be out and about with other people, to please stay home. Now, it is fine to go outside, and so to go outside in your yard or in front of your yard or to take a short walk. We recommend that you not go to parks that are very crowded. We don't want people to be clustered together. But if you're practicing social distancing, being outside in wonderful weather is very healthy.
From the Record Argus, as of today, we have the first case in Mercer County. Can you say if that person is in treatment in a hospital? If so, what hospital? And if the person's at home, can you say where they're from?
I don't have that information at this time, and we don't release individual patient information because of confidentiality and privacy.
And then a question from the Record Herald. I have a list of essential and non-essential businesses. Pharmacies do not appear on the list other than wholesale. Health and personal care stores is labeled no, and the ability to continue operations. Can you explain the difference?
So pharmacies are allowed, I mean, people need to get their medicines, so pharmacies are allowed to be open. And we'd be glad to look at that, and really we'd discuss it with DCED.
From ABC 27, how many strains of the virus are there? And do the tests detect various strains of it?
So there are actually a number of different possible strains. Again, this is a novel coronavirus, and so we're still learning about that. The tests that we have are able to detect any of the strains. They're not that different, but there do appear to be different strains that had occurred in China, a different strain that is in Europe, and a different strain in the United States. But the differences are very small in terms of the genetic makeup, and it doesn't influence the test at all.
From PA Post, Penn State Health announced that an employee at one of its outpatient practices tested positive for COVID. Penn State Health said it notified a small number of patients who may have interacted with the staff member, recommending self-quarantine. For healthcare workers, what self-quarantine makes sense if a fellow healthcare worker tests positive?
Well, there are specific CDC rules for self-quarantine of a close contact of a healthcare worker. And so the recommendations that we are advising are the same as the CDC.
And then from News Talk 104.1, rural PA has been spared to this point in terms of cases of COVID-19. What is your best information on why? Because of low case counts numbers, should those living in rural Pennsylvania let their guard down to this crisis?
I think it's really important that everyone in Pennsylvania not let their guard down and stay home as much as possible, and to practice social distancing, and for the businesses that have been asked to close, to close. Rural Pennsylvania has not seen as many cases because of the lower population density in rural Pennsylvania. But each day we are seeing more counties affected, and it's so important for everyone in Pennsylvania not to be complacent. This disease is extremely serious and even deadly, and we want to try to protect the public health of everyone in Pennsylvania.
From WLVR in Bethlehem, if only sick people are being tested, but there's no way to know if all of the sick people are tested. What do the daily numbers mean? Is it reflecting the spread of COVID-19 if folks who are not ill enough to receive care are not being tested?
Well, it is reflecting the spread, but the most important thing is to prevent the spread, and that means people staying home. And if they have very mild symptoms, if they go to an emergency department or a doctor's office, then they could potentially spread it there. So in the end, the most important thing is to mitigate or to prevent the spread of the virus. So I think that our numbers are meaningful. It's very similar to the situation that we see with influenza, yearly influenza. We have case counts that we follow closely. They are very meaningful, but we know that they don't represent the true number of cases in the state, but they still help us from a public health point of view track the virus.
From Fox 43 News, some companies online are marketing at-home COVID-19 testing kits that are not approved by the CDC. What should people know about these tests, and can they produce false negative results?
So you're correct. They can produce false negative or false positive results. And so we do not recommend any test that is not approved by the FDA and the federal government. We have heard that there is a new, more rapid test for healthcare providers that just, I think, received FDA approval yesterday, but the results can be obtained within 45 minutes to an hour. That would be very important and a very important development. We'll be looking to check on the availability of that test, but that again would be for healthcare providers. At this time, there is no approved home test for COVID-19. Please don't believe everything that you see on the internet or every advertisement. If they produce false negatives and false positives, they're going to give you inaccurate information, which could be dangerous.
From News Talk 104.1, New York has announced other possible facilities that might be converted into hospitals. What guidance can you provide hotel owners if their properties are needed?
So we are working on that right now. So we're working with the Department of Health, the Pennsylvania Emergency Management Association, and the Governor's Office in collaboration with local officials and healthcare providers and county municipal health departments on what type of facilities would be best to deal with the whole continuum of care, from intensive care units, of course, regular hospital beds and step-down units, and then possibly using ambulatory surgical facilities, and then for post-acute care, for more convalescence, possibly using hotels. So we're looking at that, and the expectation is that this week we'll be discussing what those recommendations are.
From PA Post, are there concerns that some of the closure orders, like closing the state wine and liquor stores, created a larger than usual crowd at some of these businesses?
Well, we hope that we do not have, and the goal is not to have crowds at businesses. And so that is why we have closed down non-life-sustaining businesses, and we want people to go to the grocery store, the drugstore when necessary, and otherwise, please stay home.
From the Associated Press, is Pennsylvania seeing a rush on buying hydroxychloroquine or the medications that treat malaria? I apologize, Secretary.
Sure. So you're talking about a medicine called chloroquine or hydroxychloroquine, which can be used to treat malaria. So I'm not aware of a rush for those. Of course, that is a prescription medicine, so it would have to be prescribed by a healthcare provider. And so to quote Dr. Fauci, who is the head of infectious disease at NIH, we do not know if hydroxychloroquine or chloroquine will be a successful treatment. It might prove beneficial. It might prove beneficial with another medication as a combined treatment. And of course, as he said, the key would be under what circumstances should it be used, what dose should be used, how long it should be used for, when it can be stopped, and under what circumstances. There's so many questions. That is why, as I mentioned before, the FDA and the NIH will be doing clinical trials of medications, as we do with other medicines, to check the effect. It would be dangerous to use these type of medicines for something as serious as COVID-19 until we know what we're doing. So those clinical trials are being sponsored as we speak, and I would anticipate that our fantastic academic medical centers and pharmaceutical companies would be involved as well. And so we'll await the results of those trials.
From the Tribune Review in Pittsburgh, should parents of children stop all play dates? Can you provide some guidance?
Yes, I'm sorry. And as a pediatrician and as a parent, I know how hard this is with particularly young children. But we do not want you to have play dates. That will expose the children and parents to others and could help spread the illness. So we want family units to stay together, close family, and not to have play dates, even though I really do understand how difficult that is.
From WLVR in Bethlehem, what percentage of Pennsylvanians do you expect will ultimately become infected with COVID-19? Are there worst case and best case scenarios? Do you have an idea of the range?
Yeah, we're doing modeling studies, and we've been working with some of our excellent academic centers, such as Penn and Pitt, in terms of those modeling studies about what different scenarios might be. I don't have specific numbers to tell you, but it highlights the importance of the quote-unquote mitigation efforts, the efforts to maintain social distancing and prevent the spread. That is going to be one of the absolute key factors to avoid that peak of cases, which could overwhelm our healthcare system, as discussed daily by Dr. Fauci of the NIH. So the different scenarios highlight the importance of these efforts as outlined by the governor.
From the Bucks County Courier-Times, can you tell us, are most of the COVID-19 cases still considered mild and not requiring hospitalization? Mm-hmm.
Well, as the data that I've been discussing, approximately 10% of the COVID-19 cases seen in Pennsylvania and throughout the nation have required hospitalization. Our data so far indicates that approximately 4% of cases have required intensive care, and approximately 2% have required ventilators. As the number of cases go up, what we expect is that surge of cases could put a strain on our healthcare system, which highlights the importance of two efforts at the same time. One, as I've been saying before, the importance of those prevention efforts, staying home, closing businesses, and practicing social distancing. And the other is our efforts to work with local officials, county municipal health departments, with the Hospital Association, with PA Med, and with hospitals and health systems themselves to prepare for that surge. We would be preparing in terms of supplies. That includes resources such as personal protective equipment, ventilators, etc., to prepare in terms of staffing needs, to prepare in terms of space needs, number of beds, etc., as we have been discussing, and then different standards of care. All of that work is going on as we speak.
From WGAL, is the Department of Health considering opening vacant hospitals like York Memorial and others to handle a possible overflow of cases?
So I have no specifics at this time, but all considerations are being looked at to deal in terms of bed needs, space and bed needs for this surge. So we'll be looking at all options with county officials.
And this is our final question from WFMZ. What is the status of supply lines to hospitals? Do doctors and nurses have the supplies they need to safely and effectively treat people? Can the public do anything to help?
So we have been looking at that very carefully, and we're in contact with the healthcare associations, with HAP and other different stakeholders, and we want to make sure through our work through the Pennsylvania Department of Health, through the Pennsylvania Emergency Management Association, with the Hospital Association, what are called the healthcare coalitions, to make sure all healthcare providers have the resources that they need. If they don't, they should reach out through these healthcare coalitions, and we'll make sure that we put out the stores that we have.
Thank you so much, Secretary. That is it for our questions for today. We will bring our next briefing to you tomorrow.
Thank you very much.